Hi, everybody. Happy Sunday. And I know that I say this every week, but I just cannot believe that we are already at week 9. You're rapidly coming to the end of your journey in children's health. Well, let's see what we have going forward. Our devotion this week. This week, we're going to be looking at kidney disease. And it can affect children in various ways, ranging from treatable disorders without long term consequences to life threatening conditions. Acute kidney disease develops suddenly, lasts a short time, and can be serious with long lasting consequences, or may go away completely once the underlying cause has been treated. Chronic kidney disease does not go away with treatment and tends to get worse over time. CKD eventually leads to kidney failure, described as end stage kidney disease, or ESRD, and is treated with a kidney transplant or dialysis. Children with CKD or kidney failure face many challenges, which can include a negative self image, relationship problems, behavior problems, learning problems, trouble concentrating, delayed language skills development, and delayed motor skills development. And children with CKD grow at a slower rate than their peers and commonly have urinary incontinence, further affecting the social and emotional development. So often, when children have kidney disease, end stage renal failure, they are of short stature. It definitely causes an impediment in their growth, and um, they may also um, suffer from edema. Sometimes these children are on high doses of steroids. If they get a transplant, they have to suffer the consequences of the immunosuppressant drugs that they take, so that their body doesn't reject the kidney. So these children really do suffer a great deal of dilemmas in life. So our objectives for this week is to perform a comprehensive um, health status developmental and risk assessment of children using diagnostic measures, including laboratory, radiographic, and other technologies, formulate differential diagnoses, and so forth. It's the same as it is every week. Your readings in Hay 23 and 24, and there are some sites that you can go to that refer to kidney disease in children. And let's go to this. We have our clinical rounds discussion, and you're going to do it exactly the same way you have been doing it. You've been doing an absolutely outstanding job doing your clinical case studies. Don't change a thing unless you've heard from me, but I have to be honest, I don't think I have even had to consult with anybody. I mean, been doing a phenomenal job. And individual case study, cultural differences, so you have two discussions this week. The clinical case study, which is what you've been doing before, and this one is your case study discussion. I want you to talk about different cultural practices that you've seen in your practicum practice. At least two scholarly resources, and I'm more whenever you guys are doing these things, I am more interested in the quality of the content than the quantity of the content. Someone can submit a paper that's 3 pages long and says nothing, when someone can submit a paper that's 1 page long and says everything. Now, I don't want you to submit papers. I want you to copy and paste onto this link here, just as you've been doing. Copy and paste. And I think those are the scenarios for this week. Let's go back and look at our announcements because I want to make sure I didn't put it in my date book. Let's see. The midterm review. No, that's not that one. When is the final review going to be held? Shoot, I didn't write it down. I'll have to look in my email and post it. I didn't write the date down, and I don't know if I put it in a link. Let me see. because I want to make sure that I remind you guys of it. Yeah, see, I didn't write it. It would be in here. So I'll post that. I don't want anybody to miss it. And if you have any questions or concerns, please contact me and I will help you as much as I can. Have a wonderful week.